Yeah, हो गया, right. You're live. Just
Okay,
make it gallery view.
are we live?
Yes, sir.
Okay, so welcome everybody. I think welcome to this program today from Orthopedic Research and Education Foundation, named for DMB students and PG students, brought to you through Ortho TV. And today again we have Professor Taneja from Indore, who's going to talk to us about various aspects of scrubbing, draping, gowning, etc., which again is important for infection prevention. So over to you, Professor Taneja.
Thank you, John, so much. And this is in our series of lecture, which has been devoted basically to the operation theater techniques, which is our experience that our students think they are very basic things and they have no proper reading on their subjects, and they are sometimes unable to answer a very basic question, and which does not put in a good impression on the examiner. So the Oref India thought we should have these basic lectures. We had a lecture on sterilization, then we had a lecture on sutures and needle, and then I was asked by John that if we can talk a little bit on scrubbing, gowning, and gloving. So this is what our a brief talk is going to be there. So my agenda will be that I'll bit a little bit share with my student the history of how these things started all over the world, then how we'll tell you how proper scrubbing is done, how the gowning is done, how the gloving is done, and then what is our conclusion. Now, history is very interesting. You see, if you go into the literature, you find that almost mid 19th century before, there was no much mention about the hand wash and about the disinfection, about the microbiology and about the bacteria, though they are mentioned of about the pus in a different way. And Oliver Holmes from the Boston University in 1843 did talk about that the hand washing is important. As you know that the whole story started that the patient who were undergoing a normal delivery, the many of ladies would be getting an infection after the delivery, and they didn't know what was the cause of this infection, and and the surgeon decided that if he washes his hand and then he goes for the delivery, the infection rate was coming down. And that is how the idea came that they are probably uh, passing on these germs to the area of operation, and this is what the infection is going on. In 1860, Spencer Well, he emphasized that we need to have a fresh towels, clean towels. We should have wash our hands properly, and we don't want any spectators in the OT. You remember that even in my days when I was in a medical student in Agra, we had the operation theater within a something this type, and we used to sit down in the operation theater, and which was covered by the glass and see from the top the operation being performed because there was no other way to see the operation. So he said that this is the great source of infection, and this is what this thing. In 1861, again the Semmelweis from Vienna, he again emphasized on the hand washing. That the hand washing is extremely important for prevention of any type of infection while doing a surgery. Of course, we all know that the father of the antiseptic surgery, antiseptic era, Joseph Lister, in 1865, who talked about and demonstrated effectively the effect of disinfection on the reduction of surgical site infection. And he emphasized the use of, we all know that carbolic acid, and by diluting the carbolic acid, and they will wash their hands without putting any gloves and will do the surgery, and will at the operation area they will also do the carbolic spray, and that will, according to Joseph Lister, they found the incidence of infection rate, or at that time it was called as just infection, that surgical site infection was much lower. In 1895, it was standardized that before you go for surgery, you have to take these three steps. One, that you wash your hands with the soap and hot water for 5 minutes. You apply 90% alcohol with a brush for 3 to 5 minutes, clean your this thing, and again rinse your hand with an antiseptic liquid and go for your surgery. So these three steps were by 1895, that is the end of the 19th century, this thing was getting established. And then the Friedrich Trevel was a gentleman, because this both in France and Germany, they were becoming almost very particular about the cleaning of the patient, surgeon wearing a special type of shoes and putting on the gown. This thing started in Germany and France, and but still many people, surgeons, they had a laugh on this thing, that what is the need to put on a special shoe, what is the need to put on a gown, and this at that time, by that time, by 1896, the carbolic acid was given up because it was causing a lot of problem, and less surgeons were using the carbolic acid. In 1910, this is a very interesting story, that William Halsted, who was a surgeon in America, his wife was a OT nurse, and one day his wife said that I'm not going to scrub and I'm not going to assist you, because using carbolic acid I've got a severe dermatitis of my hands. So there's a big problem. And William Halsted had a very good friend in a Goodyear tire company, and he talked to him and he said, can you do something for my wife? She doesn't want to scrub. He said, okay, I'll try to prepare some type of rubber gloves for your wife. And that is how the rubber gloves were developed for the first time. And William Halsted's wife, who was an OT nurse, started using it. And since then, the gloves became a part and parcel of our whole OT attire. In 1939, there was a little bit of controversy whether we should be washing hands for 7 minutes, 10 minutes, 5 minutes. And the price was the surgeon who said the 7 minutes good hand wash using any soap or anything, and then using the alcohol for 3 minutes. So he also emphasized that 10 minutes of washing this thing. And as we were coming up as a students from the, we were also told that maybe minimum 8 to 10 minutes you must do a proper scrubbing before you go for surgery. But by the 1900 and say around 55 or around 1960, everybody started realizing that when they did some controlled studies of the bacterial count after 10 minutes of scrub and after 5 minutes of scrub, they did not find much of the difference, and therefore they started saying the scrubbing time should be not more than 5 minutes. This is what is now the standard all over the world, that we are now scrubbing for about 5 minutes time. Now, when you are planning to go for scrubbing, the most important thing is that you have to prepare that I'm going for scrubbing today. I have to do my hand wash, and then I have to do the gowning and the gloving. So the scrubbing is that you know that today is your OT day. So the whole thing starts from your home. You must have a proper shower at home, clean your body, whole body, properly shave yourself, yeah, brush your teeth, and don't use any perfume, don't have any jewelry, don't have any ring or anything, this thing on your body. Just simply dress up and go to the OT. These are the few very basic things, because I remember when I was being trained in London, we had one OT nurse who was very fond of using perfume. And one day my boss had to tell her that, look, Jenny, I know you are very fond of using perfume. Sorry, I will not allow you to enter my operation theater. So they very politely, the British ways of denying the person or saying no to them. And these are some very basic things. Still, you will find that many of our nurses come to the operation theater putting on long hair and having the nails grown up and putting on the jewelry. This is a very objectionable thing, and we, the surgeon, have a very important role to play in this thing, and especially our OT supervisor should be a very strict disciplinarian in this matter. We know that the hands are the very important part of our body. They are the tools which care for you. They are the hands which you feel. It helps you to diagnose. It helps you to give cure. It helps you to pod and provoke. And hands are very important portal in transmitter of infection. To an orthopedic surgeon, this last line is the key line that our hands are the most important portal and the transmitter of infection. We all know that all the body and our epidermis, we all the time are harvesting Staphylococcus epidermidis on our skin and our hands, which are all the time in constant use with so many external items, and that we have the millions of bacteria on our hands, and therefore the hand wash is so very important. Now, we know that any infection that takes place, surgical site infection, you know that this word was coined in 1992, is that greatly it contributes to the nosocomial infections. That is, therefore, the surgical site infection prevention is the key point, and a good surgical hand washing definitely helps in prevention of infection. So the hand washing is extremely important in the prevention of infection, which is the first and fundamental duty of any orthopedic surgeon to make sure that his patient does not get any infection. So why we do the scrubbing? You know, it's a very simple thing. It removes any type of debris and transient microorganisms which are on your hand. It reduces any resident microbial count. Whatever the count, it gets much reduced. It doesn't get zero. Remember this thing. You still are left with some count, but it's never zero, and it inhibits the rebound growth of bacteria. So you see, these bacteria try to multiply and they regrow bacteria. But if you have done a good scrubbing, at least for it has been found that for 1 to 2 hours there is no any further growth of the bacteria. After that, there is a new bacteria, and again there is a growth and multiplication of the bacteria. Therefore, scrubbing is a very important part and the first step in our surgery. So remove your all jewelry and wash the hands and the arms with any antimicrobial soap, and clean your subungual area, which are usually left, with a nail file, and start your timing. Must have a habit. Wherever you are scrubbing, make sure that you have a clock there in front of you, and then you can go to scrub, and keeping all the time your hands higher than the arm. So this is. So the technique that you have to scrub for 5 minutes. 3 minutes is the scrub area, and 2 minutes is a thorough wash, rinsing your hand in the water. So we will show you. Sorry. Just a minute, I will call my son.
So maybe you can carry on and then come back and
Okay.
it later.
Right. So the scrub that we use There are many types of scrubs which are available these days. Now, what are the characters? देवेश या नीचे आना कुछ रुक गई है जल्दी से. हाँ देवेश. So what we should know about is what is the antimicrobial action of that the scrub that you're going to use, how long its action will be there, and whether it is safe and will not cause any type of dermatitis or any type of allergic reaction, whether it is acceptable to the everybody, and that it is a cost effective. So these are the some of the requirements which makes it a good okay. So the most common scrub that we are using these days, we all know, it is an hexadine scrub or a betadine scrub. It is just the matter of choice. The नीचे आ जाते कोई प्रॉब्लम आगे जल्दी से. So both are very effective, both betadine scrub and hexadine scrub. Although some people claim that with the hexadine scrub, the count at the hand is much better in reduction of the count of the organism. And these days we have also got the impregnated scrub brushes, which you can use it and you can clean your this thing. But many of the people are not using these days the brush, and they just want to clean this thing. And my son has come there. Probably he will help me to make that video start. How this video is not starting. But इसके बाद वाला चलो. Why it is not working? हाँ इसके ऊपर क्लिक करो. हाँ करो तो क्लिक करो. Oh God. I'm really very sorry. I do not know it was working because that's a very important. It really demonstrates. I चलता रहा इसको. चल पड़ा था. Now, just carefully, all my students who are watching this thing, and those who are watching this thing, they should very carefully see that look at the dress of the our OT nurse. The most important thing is that he has tucked in his shirt into the pajama. Now, I have seen most of the time the surgeons are putting their shirt outside this thing, which is not recommended. And preferably, I always recommend the people to wear short gum boots when you are in the OT, because all the time the staphylococcus epidermidis, which are shedding from your skin, are then will not come into the floor and will go and fall into your gum boot, and your environmental count of bacteria will not go high. Now here you can see that Mr. Ram Brose is our OT supervisor who is conducting the OT technician courses, that he has taken the betadine scrub, and these in our hospital they have got the sensors by which you don't have to touch the handle of the water tap, and just by sensor you will get the water. You have to go, your sleeve should be well much high, and then you should go and scrub above the elbow. That's very important. The most very often I've seen the youngsters are, if a surgeon is in great hurry, he will not include the elbow and will just quickly come down, and you can see that he's scrubbing it very thoroughly. After he have done the scrubbing of the elbow joint, now he is doing palm to palm. This is what he is doing it. This interdigitalization going in between the fingers is very important, which is sometimes avoided. And now you can see that his nails he's trying to rub against each other, and now he's taking the thumb and doing the rotatory movements, and also on the palm of the thumb these rotatory movements. Now, these are very small things, and probably we think that what is there to learn here, but as my teacher always used to say, that we, the people in the medicine, should always be willing to learn even the smallest thing that you learn from the even from your OT technicians and OT supervisor. Our OT supervisor, and in all the hospital, I find that the OT supervisor and your OT nurse are usually very knowledgeable. And one should, I'm asking my all PG students that you should never feel any hesitant or below dignity to going to them and asking them to teach you that how we have to do proper scrubbing and this thing. The other important thing that you must see that you see the your tap should be uh, not too high and not too low, because if it is too low you have to bend yourself and go into this sink, and as a result of this thing, anything which is at the elbow will come down to your hand, which you do not want it. At the same time, it should not be too high. With that, there will be splashing of the whole water onto your clothes which you have worn. So this is the way you have to scrub it. And usual time is about 5 minutes. So if you have got a clock there, you can do that. Okay. So this is how you should do a good scrubbing. And we have talked to you about the characteristics of the scrub, and we have told you that it is the chlorhexidine and betadine, which they say. And these days we have a special type of gel which is now available. I've seen Rod Pele, he took out one a tube from his pocket in the operation theater and just put something on the his hands and rubbed and made some rubbed it, and then with that he put on the gloves. So probably he was saying that they are very effective in reducing the bacterial count on your hand and produce a lot of good disinfection, and he was very happy with that. Now, so the big scrubbing disadvantage is that the too frequent scrubbing sometimes leads to the dermatitis, and especially if your quality of the scrub is not good, it causes dryness of the skin. And sometimes, it is good to have a liquid paraffin and mix it with a little bit of alcohol, make a solution out of that, and keep rubbing it on your hand and on your forearm, or you have some type of a cream in your operation theater that off and on you should keep applying that thing, this thing. The other thing is this thing that using the too much use of the brush is also not very good, because it opens up the pores of your skin, and a lot of your organism which has been lying dormant there, they come out of this thing, and that is not very much recommended. So a good 2 to 3 times washing your hands and forearm above the elbow 2 to 3 times with a good scrub is this is what is required. Okay. Now we go to the gowning. Now the you see these days a lot of you have the ready-made gowns coming. You have the disposable gowns coming when we are doing a joint replacement surgery, or even our own gowns which are coming. There is a method to how to pack this gown and how to wrap this gown. There is a special technique to do that, and the technique is this, that it is the outer side of the this thing that which is so very important, because the you have to just, I'll show you, you have to grasp the gown, and during the folding outside face is away. You see, that's important. And you hold the gown at a shoulder level, and it will unfold by itself, and you don't try to shake the gown. That is one mistake we do that. And you then you place your hand inside the hole and raise your hand and spread the arm. Do not allow hands to come out of the gown. That is the way, because we'll tell you how the gloving is done, and your circulating nerves will tie the gown. Now we will show you that how this Mr. Ambrose has now scrubbed, has come. He has got a towel. He's going to. You can see this thing that on from. on from one side of the towel. He's cleaning his forearm, and he throws his towel there. He takes the sterilium again, and he puts it on his hand and on his both the forearm, nicely rubs it, and that is how in the interdigital area also. And when it is little dry, then now see carefully what he is doing. He has not just picked up the, he's just not picked up the gown at the moment. He has picked up his own number of gloves, and he is just see what he's going to do with that. So first he is putting on the gloves. So this technique will tell you what this technique is called as. He has put on the gloves, and with now these gloves, he is going to touch the gown. Now this is called as almost a no-touch technique of holding the gown. And after he has held this gown, now you see that he is opening the gown. The one is the inside area, another is the outside area. It is the outside area that it should not come in contact with anything. The circulating nurse is tying the gown at the back, and now you see what he's going to do that. His gown has been tied, and this is, and he has already put on one pair of gloves. Now he is going to put on the second pair of the gloves. Okay, this is called as the double gloving technique. Now these days, most of the surgeons, because of the HIV and hepatitis and corona and so many problems, that the most of the surgeons I've seen, and I use it now all the time, double gloving myself, and I'm sure all the other surgeons who are listening and the students who are listening must also be, as a precaution, they are using a double gloving. Although the tiny puncture of the gloves do take place, about which will take place. And now he is ready, and he is now trying to put down his trolley in order that everything he will see. There's got the gully pot. He's going to put it everything. So we are not taking up when we do an operation theater. Our orthopedic Oref India is conducting OT technician course very regularly, and we have written a book on the OT technique. There, one of the things that we teach them is how to lay a trolley. So basic trolley, and then we have a basic instrument, and then we have a special instrument. There are three types of trolleys which are used there, and there's a method in which draping has to be put at which place. So this is the way the gowning is done, and this is, you can see that the back is also well covered. Now these days you have the disposable gown which are coming, in which there is a. So now we proceed on to the gloving. Okay, so there are two types of gloving. One is called as the open gloving, and other is called as the closed gloving. So when say you have to do some very minor procedure, you just want to come and put on the gloves and want to just go and do a minor procedure, you can just do an open gloving. If you are doing some major surgery, it's good to go for closed gloving. So you can see that he has put on and the hands are out. The hands are in open. So therefore, this is called as the open glove. Now, the most important part of the gloving is this, that the part of the glove which will come in contact with the body should not be touched by the bare hand, because the bare hand are carrying the organism. So this is the way he has done it. This is called as the open gloving. This is the way you do it. And this is the open gloving. We Now he will demonstrate Mr. Ram Bhrose, you can see that this is a closed gloving. You can see that his hands are well inside the gown, and these hands are not touching the gloves. He has, with the gown, he has picked up a glove, and he has just put it on to this thing. Now with this hand, which has got a glove, he puts it on to the other arm also. Now, this is called as the closed gloving. In this case, the hands, the bare hands have not touched the gloves at all, and you can, now you are ready. You can make it a double gloving also, and this thing. Some very interesting studies has been done, and these studies have shown that in majority of the studies reveal that about 18% of the surgeon's gloves always have a tiny puncture after the surgery is over. And if your surgery has gone just over 2 hours, the percentage of the punctures in the gloves is about 35%. Now, you know that if there is a puncture in the glove, then the organism on your hand can pass through that puncture and can go into the operation field and cause a contamination of the wound. So this is therefore the puncture of the wound is taken to be taken very seriously, but that we do not know when our gloves get punctured. So the people started using the double gloves, and when they did some controlled studies, they found that even in the double glove, the 4% of the gloves of the surgeons get punctured. So whatever you may do, the gloves do get punctured, which you do not see. The good part is that these days we are all using disposable gloves. There was a time when we were training ourselves, even in the 1970s and 80s, those gloves were again and again were being sterilized and were given to us. So what is my conclusion? That my conclusion is that the infection, which is a dreadful complication for orthopedic surgeon, has been present since the beginning of a civilization. Organisms has been isolated, antibiotics have come into this thing with much euphoria, then despair due to resistance, new strains are being identified, and so are the newer antibiotics, and very costly antibiotics. What is important is that we take all measures to prevent the infection, and if at all there is an infection, then it should be handled at a war footing. However secure and well-regulated a civilized life may become, bacteria, viruses, protozoa, etc. will always lurk in the shadow, ready to pounce when neglect, poverty, famine, etc. lets down our defense mechanism. So whatever we can best do is we should do that. Therefore, I always say that an effective surgical scrub is the most powerful in infection prevention, that is the surgical site infection. Very important. So scrubbing is very, very important. Two, we are using gloves because as we have told you about the gloves, the puncturing of the glove, they give us a false sense of security, but they are important because you are dealing with a lot of patients of HIV, hepatitis, and you are dealing with a patient with corona. Always use a double gloves these days. This is my strong recommendation. Aseptic gowning and gloving are again important for the prevention of infection. We have not covered here draping, but we can that part is a different thing. The primary draping and secondary draping and tertiary draping, which is also an important part that everybody should know. And with this, I end my talk here with my lots of thanks to the chairman, Dr. John Mukhopadhyay of Oref India. Thank you, sir. Any question?
Thank you, Professor Taneja. And that was excellent exposition of the various aspects of washing and gowning. And I think now we should leave it to the youngsters to ask questions. So
DNBs.
please ask your questions. And
Hello, sir. Good evening, sir.
Yeah.
Sir, one query about the part preparation, like hair removal, sir.
Mhm.
Hmm. The
And when should
good,
it be done, and by what method, sir?
very good question. You see, the previously I may tell you, the previously it was taught to us that you should do a shaving of the part should be done. It should be done a night before the surgery. Whole, if you have an operation to be done on the thigh, then whole of the thigh should be shaved, even in part of the abdomen and part of the leg. But now there are lots of studies which have shown that this is not required at all. Actually, now they are saying that you should do the preparation of the part just in the outside your operation theater, half an hour before this thing. And the best thing is either by doing a clipping, and that is small area where you're going to put in an incision. And sometimes they say you should use a hair removing cream, that is far much better. But never use the blade. If at all you're using a blade, use a fresh blade and very careful. Make sure that you don't make any cut into that. Okay, that's a very, very important thing, and I'm happy you asked this question.
Thank you, sir.
I
And
think,
sir, yes,
sorry, I think what the reason for that is that if you do shave them before, there is colonization of the skin from
Yeah.
bacteria, whatever little scratches, etc., there may be, and you end up actually increasing the risk of infection. So now the sort of practice or the recommendation is to do it just before surgery. Okay, so
yes,
and
sir. Sir, one more query, sir.
if there is
Some,
not much hair, then you actually don't even need to shave. So it's
okay, sir. Just like in pediatrics patients.
exactly. So you don't have to shave it just to. It's if there's long hair, then it gets in the way. It creates problems. So then you better to
Okay,
of it.
okay, sir. Sir, one more query, sir. Some center or some surgeon prefer overnight scrubbing, especially in the cases of the orthoplasties, TKR or THR. So, then any advantage of overnight scrubbing?
uh, of the patient. Yes, you are absolutely right that patients who are undergoing a very major surgery like a joint replacement where you're going to use a cement, we always recommend that that part should be clean within a chlorhexidine or betadine scrub. Just clean it,
Yes,
scrub it, that's all. Don't use any brush, clean it. And after cleaning it, if you have gotten a sterile towel or something, wrap that area into this thing. You are from the skin, you have been able to remove lot many organisms from that skin, and the skin count of the bacteria will be much less. And of course, then in the operation theater, you nicely scrub that area. That's a good idea. And I do it myself because I don't want my patient to get infection. Yeah.
okay, sir.
Yes,
Thank you,
that's
sir.
important. And so even they recommend a shower before the patient actually, uh, few hours
Comes
before
to it.
the patient's actually coming to the surgery.
Okay, sir.
So,
Thank you, sir.
mm, yeah. Any other question?
All covered, sir.
Okay. So,
Everything, all
Sir,
surgeons, they say, why
yeah.
sir is
Yes,
talking
Sabine.
so basic thing. Sir is talking so basic thing, everybody knows it. But there's very small few things that everybody learns in due course of time, and one
Yes,
should
sir.
follow that. And my teacher in orthopedics always believed that the most important thing for reducing a surgical site infection is not antibiotic, it is the OT discipline. Okay?
Yes, sir.
The OT
Yes.
discipline includes everything, your movement, your talking, part preparation, your tissue handling, dead space, use of cautery, sterility of your theater. And he would cite an example of his teacher that in a pre-antibiotic area also the infection rate in their hand was about 2 to 3%. Those who have maintained a very strict routine. Now we have, it is almost full circle. We have now almost come down to that thing. Now there are many surgeons who are not using antibiotic at all, for neither prophylactic antibiotic Now they are using it post-mortem antibiotic. Of course, majority of them are now using prophylactic antibiotic and just no antibiotic after 1 day. Okay, so all their use of the antibiotics are almost is becoming less and less and less, and more people are now going on to the good strategy. Now you see the operation theaters in India, the modular operation theater, and the good microbiologist available with you, and the regular culture of your OT has really helped a lot to this thing. And you know, good cautery, negative section, all these has helped us to reduce the infection rate from a very high infection rate. I remember that when we had a national conference in Jaipur about the infections in the bone, and the people said, sir, at one hospital in Ranchi, somebody said, sir, we have 100% infection rate. Now it is nowhere in the country, nowhere. Even in the district hospital, people have made a very good improvement and the infection rate is much reduced. I'm sure that all Ashok and Neeraj and John and Janki and myself, our infection rate is somewhere around 2% or maybe less than 2%, which is a very good standard to be maintained.
And sir, what is the standard incidence of infection rate should be maintained in hospitals, sir?
It's a very good question, Bete. The you see that you must know what are the international standards. Unless until we
Yes.
know our international standards, we cannot talk about that what infection rate is acceptable. Now, in international standards say that your infection rate should be below 1%. Okay,
Yes, sir.
John Charley was trying to bring the infection rate to 0%. Eventually, he gave up and he said it is impossible to have a 0% infection rate. So then the world accepted that if you have a less than 1% infection rate, it is a highly acceptable and international standard. Any infection rate of your operation theater between 1 to 2% is well accepted all over the world. Okay. Now, if your
And
infection rate, they say, goes beyond 3%, they say it is a very serious matter and it's a matter of concern and you must make an inquiry into this thing. That is the very important thing. And now how do you monitor your infection rate? That's very important. Because in our hospital, we have an infection control committee, which all good hospitals have got. Any case which gets infected has to be reported to the infection control committee, and we analyze that where did we go wrong and why this patient got an infection. Okay, so please,
yes,
you
sir.
should do your own auditing. That what is infection rate in my hand, what is infection rate in my unit, what is infection rate in my department, and what is my infection rate in the whole hospital. Then you will be able to improve yourself. Okay.
Okay, sir. And sir, this include acute and chronic infection both, sir.
Pardon?
These standard data, sir, include
No, we
acute
are
and chronic.
no, 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 not at all. We are talking of surgical site infection. Surgical site infection means a post-op infection in a elected surgery in a non-compromised patient. So if you have got three
Okay.
things, then उसमें कितना infection rate हम उसके बात कर रहे हैं.
Okay, sir. Okay, sir.
So, there is a question asked by Dr. Sanjay Gorai. He want to know what is the rationale of use of betadine, sprit, and chlorhexidine for patient scrubbing before surgery, and what should be the sequence?
We have already told you, you see, they are antimicrobial. And when you are using the hexadine or you are using the betadine, you see what it is doing it is trying to help and create that foam, and with that you're rinsing it off your hand, and then lots of the organism which are present in your hand are washed away, and the bacterial count on your hand is much reduced. It never becomes zero. Therefore, and they're antimicrobial, so therefore they help you in prevention of the organism. And if the few of these organism even might die, we do not know about it, but your bacterial count is much reduced. This is what the whole objective of the scrubbing is.
And
I
about
think it was
yeah.
about the for the cleaning, painting of the patient.
Yeah, yeah.
It's actually somewhat similar. Now, the sequence usually would be to use either betadine or chlorhexidine. You don't use both usually, and you can follow it up with spirit.
You see what we are doing in our hospital, that if the patient comes there, one of the OT nurse will take a betadine scrub.
Yeah,
Okay,
first to
with
scrub,
that
that's
betadine
different.
scrub, we'll clean the whole area very thoroughly. Very thoroughly, he'll put on the gloves, but do it very thoroughly. And then once you have done then it comes to painting. Once the scrub has been, the part has been scrubbed, then comes the painting. And the usual painting is done that yourself or this thing will take in a betadine and will do the painting of that whole area. And sometimes we take a sterilium because it is all yellow color. In order to clean it, then you can use a sterilium and clean that whole area, and you can dry it with a mop, and you can do then draping, and you can go ahead with that. No problem.
And probably Sachin has one question.
These very small things of painting, scrubbing, draping. Draping has to be very, very important. How you should be doing the draping, we can even talk on this for a very long time. And these all things help you to reduce your infection rate. People talk too much in the operation theater, and they don't realize the patient is under a block or under a spinal. Patient is hearing everything from you. So you should maintain a very good pin drop silence. You should maintain a very good humidity, which should be around 50%. You must have a temperature of about 20 to 21 degrees. All these things help you to reduce this. And I conduct a course, and I've been telling this thing that there are 5 zones in the operation theater. I'm sure you all know that: white zone, yellow zone, blue zone, red zone, and a black zone. Now, what is a black zone? The black zone is the one which is all around your operation table. Okay, so in that, once the trolley comes in, your OT nurse will come in, your surgeon goes in, and then the assistant goes in. Okay, now nobody can, this whole team can either go out of this black ring, and nobody circulating nurse can come in the black ring. So this is the high level of this thing. Of course, you have a laminar airflow system working it, and the circulating nurse, anything has to we remain outside this Lakshman Rekha and give this thing. Now, these small things, when you follow, you find that nobody believes that, sir, that you have an infection rate hardly 1% or 1 to 2%. How it is possible? I say, you come and see that how my Mr. Ram Bharose is so particular about this thing. He will touch and write down on the blackboard what is the temperature of the OT. I ask the people surgeon, what is the humidity of your operation? They do not know. हमको तो मालूम ही नहीं है. And in our operation theater, we have a humidometer and we have a thermometer. The first thing my assistant will do, put down the humidity and put down the temperature, this thing. And these small things matter a lot in prevention of a surgical site infection.
Yes, Sachin. Yeah.
Hello.
Yes, Sachin, ask.
Sir, as per sir told us that the hand washing time should be 5 minutes. If we go more than one setting, the time will be remain the same or it should be reduced.
What?
The first time, if it's 5 minutes,
Yeah.
Do you have to do 5 minutes each time, or the subsequent scrub you can do?
No. Total time scrubbing is about 5 minutes. Okay. So 3 to 4 minutes good scrubbing with using a betadine or chlorhexidine, and 1 minute or 1.5 minutes you can put a good rinsing of within a water. This thing. I remember my friend Dilip Paul will remember that when I started doing the joint replacement in a government hospital, where we were very afraid of doing the infection, this thing. So we even made an arrangement where we would, for even washing your hands, we used to have a nice boiled water in one container, and through which a tube it will come, it will get this thing, almost a sterile water. We were trying to wash this thing, because otherwise the water which comes from the overhead tanks sometimes very, very dirty. It contains a lot of contamination. So be very
Excuse-
careful sometimes to get your overhead tanks also clean. That's very important. Yes.
Excuse me, sir. It is for if we are doing for second OT, means after first OT is finished, second time if we are going for a scrubbing, is it 5 minutes for second OT also?
Yeah, I
Second-
think this is you see, what are you trying to say? That I will do it for 3 minutes this time? No.
No,
You see, this is just saving of 2 minutes has no meaning in terms of preventing your infection. I would not do that. I think this 5 minutes is nothing. I spend so much of time sitting in doctor's room having a cup of tea, and I think I should save 2 minutes. It's just, no, it's not right thing. Whenever you never, somebody used to ask me that what is a minor surgery, what is a major surgery, what is, I said, any surgery you do on any patient is a major surgery. And you should take surgery very, very seriously. I have seen patients getting into problem in a simple incision drainage going into an anaphylactic shock, and they will get to a musculoskeletal shock, and big problems have happened. Never take any surgery very light. I never, even if I have to excise a ganglion, I'm very particular that it should be properly drained, it should be this thing, and do your surgery. Surgery is an art. You should enjoy that. Never do anything in a great hurry. Okay? And somebody very rightly said, some surgeons say he's a very fast surgeon. Then one of the teachers said, look, Devin, fast surgery does not mean repeating the surgery. He will going to create some problem. So you should have a reasonable time for that surgery. That's all. That's what you require. You're not asking for an Olympic gold medal for that.
Yeah, I think soft tissue handling and
Soft tissue handling,
is much
going
more
into
important.
tissue, going into tissue
I think
plane.
we should
Yeah.
okay, call it a day for today. So thank you very much, Professor Taneja. And
Thank you, John. Thank you so
Thank
much.
you, sir.
Sir, then,
Thank you,
sir.
sir.
Thank you. Welcome.
okay, bye everybody.
Thanks.